federal government's role in health care is under the microscope right now as President Obama pushes for health care reform by October. Our Dana Bash has been looking into Canada's system, which covers everyone, and it's free, but there are drawbacks. Let's go to Dana. Dana.
Wolf, when the Senate's top Republican speaks out against a government-run health insurance plan, he says it could lead to government control of the healthcare system. And he warns the U.S. could end up like Canada, with treatments delayed or denied. So we came here just north of the border to Ontario to see for ourselves and separate rhetoric from reality.
We gonna feed the fish?
For Shona Holmes, simple pleasures, playing with her dog, walking in her garden, are a gift. 4 years ago, she was diagnosed with a brain tumor, told if it wasn't removed, she could go blind or die.
You're blind, no doubt at all.
And I realized right after the surgery how bad my vision was. Because
Shona is Canadian, but for her surgery, she went to the U.S. because it would have taken 4 to 6 months just to see specialists in Canada's government-run healthcare system, the only option here.
All my life I've lived in this country with public health insurance. And I always thought that I would be okay, that everything would be fine. So this is basically all of the surgery.
Shona's bills at the Mayo Clinic, where she was treated, totaled $100,000 she borrowed from family and friends.
And that's the stuff that I find so tragic. Having dinner with my friends, and I know how much money I owe them.
Republicans in Washington are seizing on Shona's story and other accounts from Canada to warn against government involvement in health care.
How are the rooms running today?
Dr. David Zelt is chief of staff at Ontario's Kingston General Hospital. GOP Senate leader Mitch McConnell singled out Kingston as Exhibit A of staggering delays in Canadian care. We played Zelt the speech.
Knee replacements. Well, at Kingston General, the average wait is about 340 days.
Zelt's response, McConnell is exaggerating.
Average time to get a knee replacement here is 91 days.
But he does admit in Canada's system where the government covers everyone, there are limits and shortages. Some patients do have to wait.
I'm not going to say we don't have issues, but again, if you take the other side of the coin, these patients have access.
Despite Shona Holmes' horror story, Canadian officials insist most patients with life-threatening problems are treated quickly.
That's my dad.
Doug Wright can attest to that. He has cancer, a tumor on his leg. He's got the money to get care in the U.S., but says there's no reason.
I've not had to wait. I've seen, some of the best specialists in the country.
And though taxes are high here, he and others remind us Canadian health care available to all is free. Now, to be clear, no Democratic health care plan now on the table calls for the kind of government-run system they have here in Canada. But consider this statistic. All Canadians have health coverage. That's 33 million people, compared to 47 million. That's just the number of uninsured in the U.S. Wolf.
Dana Bash in Canada for us. Thank you. And to our viewers.